Well, thank you very much for the three speakers. I have a question for each of you, and I'll ask you to respond. The first one is Rizori Talib. The MEPI schools, are the MEPI schools working together on community-based education, or how are they engaging with each other to share best practices as they discover best practices amongst themselves in their own work?
Yeah, thank you for the question. So the MEPI network actually has identified a number of technical working groups in areas of common interest and common activity. They include such things as e-learning, medical education, research support centers, but one of the technical working groups is actually on community-based education, which has membership from all of the schools. And we have identified different virtual and on-site platforms to communicate with one another. So we, as the last slide in my presentation, we have a Facebook page that's now open for others to join the conversation on community-based education. We have a listserv that convenes the schools for online discussion. And we've had a number of workshops. We just completed a workshop in Kampala where the schools got together to think about how to develop evaluation frameworks to address some of the questions we've talked today, linking CBE to the education and health outcomes they're looking for.
Very good, thank you. Mariette, why does your evaluation of the community-based education at the rural clinical school seem to be so transformative?
Thank you, Steve. It is actually quite a transformative experience for myself, analyzing the data. And it links to what we've again discussed at the forum yesterday. It appears that continuity seems to be one of the key issues in the experiences that these students undergo and the way that it changes them. Continuity firstly with their supervisors, their preceptors, who didn't have medical students or students before and were antagonistic in having these students for a year. But working together for a year changed both the students and the preceptors. The students became part of the healthcare team, of the interprofessional team, and the supervisors or preceptors has a great interest in them passing the examination at the end of the year. And secondly, continuity with the community. And one of the slides I showed you talked to the impact of community immersion. The community gets to know the students. They call them our young doctors. They see them in the shops and say, "Hi, good morning, doctor, how are you?" They value the time that the students spend with them. They perceive it as quality medicine that they're getting. The other doctors are too busy. And the students experience patients and community in a closer, intimate, and in a way that it changes them. Thank you.
Thank you. Andrea, what's the greatest challenge when it comes to implementing the mental health facilitator program in Europe or Romania?
Thank you very much for the question. The greatest challenge, I think, would be related to the territoriality that I mentioned when it comes to the group of helping professions. And probably the biggest opponent across all the countries that I mentioned is the group of psychologists. And they claim that we should take away the worst mental health, from the title of the program. Just because they think that we are trying to create another type of professional. However, this comes as an opportunity as well, because among the group of the MHFs that we have there, we have a serious number of psychologists turned business people, managers, coaches, and now because they know the program, they are the biggest promoters of the program. So. Just to summarize, the challenge is political, is the political struggle, and this will take time to be addressed.
Thank you.
Thank you.
Please join me in thanking this panel. Our next panel will now come up, and while they do, I'd like to remind those in the web audience that if you do have questions for the speakers you've heard, you're invited to email those questions to the address that shows up on the web page. And we will get those questions to those speakers and invite them to respond directly to you. This next session will include 4 speakers, and it will be on interprofessional education related to community-based health professions education. And our first speaker I'd like to invite up is John de Mesnaer of Ghent University in Belgium. John? Jan.